Okay, it's 12:01, so I guess we'll get started. Good afternoon, everyone. Bonjour tout le monde. Je m'appelle Steve Staples. I am the National Director of Research and Policy for the Canadian Health Coalition, the organization that is sponsoring this media availability and press conference today. We're very excited to let you know that tomorrow we are organizing a rally of frontline healthcare workers, public healthcare advocates, and researchers, and just general public tomorrow on Parliament Hill to coincide with the meeting of the Prime Minister and the premiers of the provinces and territories. Today, to outline our plans and what we are calling for, we're very happy to have Pauline Worsfold, a registered nurse who is the chairperson of the organization. The Canadian Health Coalition was founded in 1979, by the way, and we comprise frontline healthcare workers, researchers, and community groups that are dedicated to defending and expanding our public Medicare system. Following Pauline will be Keith Newman, who is an economist and a board member of the Canadian Health Coalition, and he will be doing his remarks in French or English, but I think his initial remarks will be in French. And then following that, we'll have time for any questions that you might have. Okay, so I would like to introduce Pauline Worsfold, please.
Thank you, Steve. I'd just like to say we pay respect to the Algonquin people who are the traditional guardians of this land. We acknowledge their long-standing relationship with the territory, which remains unceded. We pay respect to all Indigenous people in this region from all nations across Canada who call Ottawa home. So thank you for taking time to join us today. And I'm Pauline Worsfold, as was said. I'm a registered nurse, and I'm the chairperson of the Canadian Health Coalition. I'm a registered nurse, and I work at a hospital in Edmonton, Alberta, which is Treaty 6 territory. As you know, Prime Minister Justin Trudeau and the premiers will be meeting tomorrow from the provinces and territories to discuss the healthcare crisis in Canada. It's been reported that $70 billion over 10 years is on the table for increases to the Canada Health transfer payments and bilateral deals with the provinces and territories. The stakes for Canadian Medicare could not be higher. There is a crisis in our hospitals that I witness every day when I go to work. Frontline workers are burnt out, feel overwhelmed and underappreciated, and patient care is suffering. They all want to see action by all political parties at every level of government, federal, provincial, territorial, municipal, whatever it takes. This is why public health care advocates will be rallying on Parliament Hill tomorrow to demand of all leaders Canada's public healthcare system be protected and, in fact, expanded. First, we want increased federal funding for healthcare, and the funding must come with strict accountability mechanisms to be put in place to ensure accountability and transparency. Prime Minister Trudeau must insist that premiers guarantee each dollar transferred from the federal government is used for healthcare, not for tax cuts or wasteful rebates. Second, we want to stop public healthcare dollars from going to private for-profit clinics operating outside the Medicare system because profit doesn't care. In 2020, after a rigorous evaluation of the arguments for and against for-profit clinics, the Supreme Court of British Columbia found private healthcare will not decrease wait times in the public system. On the contrary, it would actually increase the wait times. And this will also worsen the inequities within our system. Federal leadership is required urgently to defend Canadian Medicare and the healthcare system, and in fact, to expand it. It's time the Liberal government finally delivers on its long-standing promise for public universal pharmacare, a national public drug plan. In 2021, approximately 21% of Canadians reported not having insurance to cover the costs of medications in the past 12 months. Close to 1 in 5 Canadians reported the pandemic affected their prescription coverage, with immigrants being twice as likely to be affected as non-immigrants. And that's according to Health Canada. As a frontline registered nurse, I hear about people in our emergency rooms who are there because they've not been taking their medication, likely because they have no coverage and can't afford it. They're cutting their pills in half to make them last longer, and that does not do their health any good whatsoever. It's clear to me as a registered nurse that prescriptions that are filled leads to empty emergency rooms. The CHC, the Canadian Health Coalition, demand the universal drug coverage system described in the 2019 Advisory Council on Implementation of a National Pharmacare Plan, that was led by the former Ontario Health Minister, Dr. Eric Hoskins, be implemented fully. So we demand the plan is there. All we have to do is implement it. So let's just get on with it, I say. Prime Minister Trudeau must deliver on his promise to the NDP leader Jagmeet Singh to pass the Canada Pharmacare Act before the end of 2023. And this requires introducing the Act this spring. So we have no time to waste. So tomorrow on Parliament Hill, over 20 organizations representing millions of workers across this country are gathering to oppose provincial plans to privatize healthcare services and demand long-promised national universal pharmacare plan. Our slogan, profit doesn't care, stop privatization, pharmacare now. I invite you all to join us there tomorrow on Parliament Hill. Over to you, Keith.
Keith, you may wish to unmute yourself.
Et voilà, OK. Voilà, je suis au soleil dans mon salon. Donc, alors, je suis désolé. Merci et bon après-midi. Steve m'a déjà présenté, mais je m'appelle Keith Newman. Je suis économiste et membre du conseil d'administration de la Coalition canadienne de la santé. Alors, comme vous le savez, demain, le premier ministre Justin Trudeau rencontrera les dirigeants provinciaux et territoriaux pour discuter de la crise des soins de la santé au Canada. Les enjeux pour l'assurance maladie canadienne ne pourraient pas être plus importants. Nous voulons de l'action de la part de tous les partis politiques et à tous les paliers de gouvernement. Premièrement, nous voulons avoir un financement fédéral accru pour les soins de santé, mais le financement, et ceci est très important, doit être assorti de conditions importantes. Nous voulons que les mécanismes soient mis en place pour assurer la reddition de comptes et que tout l'argent octroyé par le gouvernement fédéral soit dépensé en santé et dans le système public. Donc, le premier ministre Trudeau doit insister, par conséquent, que les premiers ministres garantissent que chaque dollar transféré du gouvernement fédéral est effectivement utilisé pour les soins de santé et non pas pour des réductions d'impôts et des remises inutiles. Nous avons déjà vécu cela, où le gouvernement fédéral a octroyé de l'argent et ça a été utilisé pour des réductions d'impôts. Deuxièmement, nous voulons empêcher que l'argent des soins de santé publics aille à des cliniques privées à but lucratif opérant en dehors du système, notre système d'assurance maladie publique. Le leadership fédéral est requis de toute urgence pour défendre l'assurance maladie canadienne et pour l'étendre, pour englober d'autres domaines. Il est temps que le gouvernement libéral respecte enfin sa promesse de longue date d'un régime d'assurance médicaments public et universel. Nous exigeons que le système de couverture universelle des médicaments, décrit par le Conseil consultatif sur la mise en œuvre d'un régime national d'assurance médicaments en 2019 et dirigé par l'ancien ministre de la Santé de l'Ontario, le Dr. Hoskins, soit pleinement mis en œuvre enfin. Près d'un Canadien sur 5 éprouve des difficultés à payer ces médicaments. Vraiment, c'est une honte. Le premier ministre Trudeau doit donc tenir sa promesse au chef du NPD, Jagmeet Singh, d'adopter la loi canadienne sur l'assurance médicaments avant la fin de 2023. Donc, avant la fin de cette année, cela nécessite l'introduction de la loi ce printemps. D'autres engagements dans l'entente des libéraux et l'NPD comprennent des soins dentaires publics, les investissements dans les soins primaires et les soins de longue durée sécuritaires. Demain, il y aura un rassemblement regroupant environ 20 groupes qui vont se rassembler pour exiger que c'est des groupes nationaux qui exigeront que ces conditions soient rencontrées. Merci.
Merci beaucoup. I would open the floor to any questions. Feel free to unmute yourself and ask away. Floor is open to any questions. Feel free to use the chat. Very good. Well, seeing no questions today. Of course, we remain available by telephone should require any follow-up. And we will be on site tomorrow at Parliament Hill. We're gathering at 12 o'clock noon at the Terry Fox statue. And from there, we will move on to Parliament Hill and have a number of speakers and guests who will be at by the Centennial Flame. And we will be finishing at 1 o'clock tomorrow. Merci beaucoup. Have a wonderful afternoon.
Thank you, everyone.
Merci tout le monde.